Hi, this is Pam Rodriguez from COSO 2230. My business is healthcare related, primarily nursing. My role in my group project focuses on employee health and safety. So, in keeping with this theme, I decided to pick a topic within nursing. My topic is bedside shift reporting. The article I've chosen is The Value of Bedside Shift Reporting, which was retrieved from the Journal of Nursing Care Quality, September 2013. Most people outside of nursing may not be familiar with this concept unless they've been hospitalized in a facility that uses it. My facility has done bedside reporting for quite a while now, but just recently started to really enforce its use. In my quality nursing course this semester, one of the topics we've been discussing is bedside shift reporting. I wanted to incorporate a little bit of background of what bedside shift report is and how it can really boost patient care in the hospital setting. Many nurses might even find this to be a new topic. So let's review. A hospital is a 24-hour care facility. You have nurses and staff members working around the clock to provide care to patients. When I get to work, I find my assignment and I start looking up information from the patient records. I look at what orders might be pending for the patient, what needs to be done for the patient. I also look at any test results and what tests are pending, what the doctor has written in progress reports, and what discharge planning information is done. As my coworkers do, I try to get a general idea of the patient's situation. When I go to the bedside report, I am given a more detailed update of what is going on right now. It's really imperative that this information follow the patient from shift to shift. In report, we try to paint that picture of the patient's current situation. Starting with the head-to-toe approach, after the basic identifying information, we continue the report. Bedside reporting is done, as you would think, at the bedside, and the patient is right there. Using the head-to-toe format, the patient's mental status is noted. Are they alert and oriented? If they're not alert and oriented, why not? We would discuss their chief complaint for being hospitalized and where the treatment process is in addressing that chief complaint. We would continue our head-to-toe report and point out anything that should not be there, perhaps, like an IV site, a urine catheter, or maybe the patient is using oxygen and has that tubing. You've seen people with that tubing on. These are things that we have added to the patient in the course of their care. Now, some of these items, like perhaps the oxygen with a COPD patient, might be something that they came in with from home. This is something that needs to be noted in report. So, as you can see, we're already starting to paint a picture of the patient and where they were, where they are now, and where they're going. Recent test results, their significance, and also pending tests would be discussed. And the patient is involved in the process with all kinds of questions. After the introduction, I might say, "Oh, Mr. Fazio, my name is Pam. I'm going to be your nurse today. Can you tell me, are you having any pain today?" Now, Mr. Fazio might not be here for any kind of pain, but I really need to know, is he experiencing any pain? Now, by engaging the patient in conversation, I'm also able to assess their mental status, and compliance with their treatment can really be evaluated at this time to some extent. Nurses are able to assess a lot of information in a 60-second interaction. Yes, just 1 minute. The outgoing nurse will usually interject things, and the new nurse will point things out. So a lot of information can really be added to the overall assessment in that 1 minute. And we can see trends, we can see baselines, and as you would think, some patients may really embrace bedside shift reporting, while others really don't like it at all. Patients proactive about their health may relish the information given in bedside report and appreciate the flow of information. I work on an oncology floor, and sometimes when the prognosis is not good, the patient really may not want to be reminded every 8 to 12 hours of the grimness of the situation. As nursing professionals, we use our critical thinking skills as well as our compassion to accommodate our patients' wishes. In this case, we would do a partial bedside report of the basic information without going into the heavy topics or those that the patient would rather avoid. The report should only take a few minutes, so again, communication is just as important as the prioritization of the facts. The Value of Bedside Reporting article cites that communication is the key to continuity of care of all patients. Personally, I have found bedside reporting to be a welcome tool in getting the information that I need on my patients. The medical chart and electronic medical record really has a lot of information, and when that information is put together, it can give you a good picture. But this is just not something that I really have time to weed through. With bedside reporting, the nurse is taking ownership of the patient and all the pertinent information at shift change. This really, as the article discusses, really enhances the accountability of nurses in the care of their patients. And when bedside report is used and the information flow is really effective, this really can ensure a seamless transition from nurse to nurse and shift to shift throughout the care of the patient in the facility. Thank you.